Thanks so much for having me. It's exciting to share the presentation with your group, and I really appreciate you inviting me. So just kind of some housekeeping things before we get started. I just want to kind of preface this with naturopathic medicine is very tightly regulated in Ontario, and as such, we are really only able to stick to kind of informational only, educational only type of questions. I'm not allowed to kind of speak about specific dosages and things like that. So just anything I'm sharing is purely informational. It's not meant to be taken as a prescription. Obviously, I don't know each of you and your personal health situation and what's contributing or not contributing to your health, or I haven't seen your blood work. So just keep in mind, this is just for information. It's not replacing a one-on-one visit with either myself or your other primary healthcare provider. So naturopathic medicine is actually if you think about what the premise of it is, we're really looking at using the healing power of nature to improve health. And this dates back to like Hippocrates, 2,400 years ago, he was formulating the concept of the healing power of nature. It wasn't until the 1800s that this kind of term naturopathy was actually coined in North America. And people think naturopathic medicine, because it's gained a lot of popularity in recent years, that it's new, but it's actually not new at all. And in fact, it's been around since the 1920s in Canada and has been regulated in Canada to at least some degree since about 1925. And a lot of people don't realize that. Now, over the more recent years, like in 2016, we actually formed the College of Naturopathy. So we are definitely a regulated health profession. We're regulated by the same government bodies that regulate medical doctors and dentists and psychologists and social workers, chiropractors, RMTs. We're all falling under the same umbrella. And in Ontario, we are granted the doctor title. Obviously, we're not a medical doctor, we're a naturopathic doctor, but we are primary healthcare providers. And so you can see a naturopath for many different concerns. Obviously, some naturopaths are going to have different areas of focus. I would say my practice is very general in nature, so I definitely work with a very diverse range of people. Most commonly, I'm working with a lot of females, a lot of hormonal issues, digestive issues, anxiety, depression. Those are kind of the common reasons people see me, but you could see a naturopath for an earache to cancer and everything kind of in between. And in the last 20 years, we've really seen a surgence of people being interested in taking health into their own hands, and people being a little bit dissatisfied and well, let's say like conventional medicine hasn't always been fitting some of the chronic health issues that people are dealing with in our modern age, right? We're seeing lots of lots of increase in stress, anxiety, insomnia, chronic digestive issues. And a lot of the times, conventional medicine may not have the right tool to remedy those. In some cases, absolutely, yes. But for a lot of chronic conditions where there's a lot of chronic pain or discomfort, or there's not a bone broken, there's not a cancerous tumor growing, sometimes there's not always a medication that is as effective as looking at nutrition and lifestyle and looking at how we can support the body to heal itself. So that's where I come in. And so in my practice, I practice in downtown Hamilton. I've been in practice for over 10 years, and I'm a very, let's say, adventurous and outdoorsy sort of person. And so I definitely bring that to my practice. I've done a lot of crazy things, and I've climbed Mount Washington before. And in case some of you aren't maybe familiar with Mount Washington, it is a mountain that people train for to go to Everest, not because it's tall, because it's in the Eastern Seaboard, like it's in New Hampshire. It's very extreme in terms of the weather and the wind. Some of the highest winds and lowest temperatures have been recorded there, and so it's that harshness that makes it a training ground for climbing something like Mount Everest. So it's something I'm really proud of having done. It's like it takes 9 hours to climb, kind of like in the winter, like that's it's a day hike, but it's more than a day hike. It's more than a hike. You're mountaineering at that point. And I've done things like cycle across Ontario. So I have a lot of interest and enthusiasm about nature and the outdoors. And certainly, I suppose that's why I've been attracted to naturopathic medicine. But I really try to embody those practices of getting outside, of being active, of engaging in things that I'm passionate about, because that's really what sets you up for long-term health. And those, I embody those practices, and I encourage my patients as well. And so getting out in nature is a really big part of my practice. And I actually have a lot of even just like programs that I'll take patients on. So going on backcountry camping retreats, or we'll do different day retreats where I've taken patients hiking and sort of things like that. So I have lots of different programs within my practice. It's not just, a lot of it is one-on-one care, but I have lots of other things as well. So common problems with patients living with bleeding disorders that we're going to focus on in terms of nutrition today. So obviously, I'm sure you all are well aware, like a lot of these inherited bleeding disorders are genetic in nature. We can't alter them, you can't cure them per se, but we can help manage some of the consequences, right? And so we're going to be looking at, looking at how we can heal the body, deal with low iron status. Joint pain is often more common in patients with bleeding disorders, and obviously for female patients having heavier menstrual cycles. So first of all, this next slide, I want you to like burn it into your brain, because this is not just for people with bleeding disorders. This is like nutrition 101. And we're going to build on this slide as we move through the talk, but I really want you to take a snapshot in your mind. I really prefer the healthy eating plate by the Harvard one that's a cartoon, but I visually like how the Canadian one looks. But I just feel like you can see my cursor when I move it, right? The healthy oils is missing from the Canadian one. I think that's something they really overlooked, but I really appreciate how on the Harvard Food Guide, they've noted how you should have more of your nutrition be vegetables than fruit, whereas here they've kind of just made it imply that it's half should be fruits and veg. And a quarter should be whole grains, a quarter protein, which this is a big area we're going to focus on. And they say right on it, drink water, tea or coffee, limit milk and dairy. You know, in terms of vegetables, potatoes and fries don't count, and really think about using healthier oils like olive oil. I blacked out, they say canola oil. I disagree. Canola oil is like a genetically modified oil. I wouldn't encourage you to use that, but definitely healthy fats are important for our overall health. And in my practice, most patients are not drinking enough water. They're not eating fruits and vegetables, or not very many, and they're not having any protein in their diet. It's like we're carbitarians in North America. And that goes without saying whether people are vegetarian or they're meat eaters. And so this is something, really use this simple diagram. Don't overthink things. Don't stress yourself out. Just at each meal, approximately half of your plate should be fruits and veg, a little bit more than half of that. Like it should be kind of 2/3 vegetables, 1/4 fruit. And then I don't think my math added up there, but you know what I was getting at, a little bit more vegetables than fruit. 3/4 vegetables, 1/4 fruit. And looking at healthy proteins and just choosing a variety, making water your drink of choice. So going a little bit deeper into the protein deficiency, because this is the most common nutrient I see being deficient in people's diets, and why it's relevant to people with bleeding disorders is that protein is needed to improve wound healing. It's needed to build blood. It's needed to, it's like hemoglobin. I don't know if anyone here remembers their high school or university science, but globin is a protein. So hemoglobin, heme is iron, globin is a protein. So your hemoglobin that carries oxygen in your body, it's literally an iron carrying protein. And so you need to acquire protein through your diet, and it should be about 1/3 to 1/4 of each meal. And you can calculate personally how much protein should I have by just figuring out how many kilograms you weigh. So if we took an average adult, 150 pounds, that would convert to 68 kilos. So that person would have about 68 grams of protein a day for optimal health. Now, if you're, certain populations, like if you're very, very active, then you're going to need to have more protein. So with your protein, you just want to make sure it's about 1 gram per kilogram body weight. If you're really active as an individual, then you're probably going to need a little bit more. If you're a vegetarian or vegan, also probably need a little bit more, because there's not a lot of protein or not a lot of amino acids available in plant-based foods. So you could probably even double it to 2 grams of protein per kilogram body weight. But honestly, most of my vegetarian and vegan patients are so grossly malnourished in terms of protein that even having the 1 gram a day is a good good place to aim. And I could do a whole talk just on nutrition alone regarding protein. So I kind of have to keep moving and glaze over this, but certainly it's something maybe some of you will have questions that you can ask later. The driving point though that I want to make why protein is important, it's going to help to improve wound healing. You need it to build red blood cells, which is going to carry oxygen to your body, so it gives you energy. Protein also actually helps to stabilize your blood sugar, which then stabilizes your mood. So if you're someone who's prone to fatigue or mood swings, or you feel anxious, those things also can be worse with people who are iron deficient, which people with bleeding disorders are prone to. But there's other things that can also improve, mood swings and prevent anxiety and prevent insomnia, and that's more protein in your diet. So there's a lot of things that can be benefited by simply eating more protein, and whether it's plant-based or meat protein, like animal protein, I don't have a preference as long as you're getting your protein. And I mean, per gram of food, like animal proteins, unfortunately, they are much denser in terms of protein. So for example, 3 ounces of chicken or beef or fish is about 20 grams of protein, versus an egg would be 6 grams, like let's say a large egg. And then about, let's say, half a cup of beans or chickpeas or some kind of legume is usually around 9 grams of protein. And you have to think, like with beans and fiber, you can only eat so much. So remember that half a cup is only 9 grams. You need about, let's say, 68, 70 grams of protein a day. You do have to work quite a bit to make sure at each meal you're eating enough protein. And I just realized I didn't include, I have like maybe I can email it to Natalie and she can email you guys later, but I have a protein spreadsheet that I can always send out. If you can easily Google it too, like just protein content of foods, and you can quickly see like what foods have more protein than others. So when I'm talking about protein, it's predominantly the things you're seeing here in this picture: yogurt, beans, lentils, eggs, salmon, turkey, meat. You can have tofu or tempeh. And one unique grain, yes, it's in the grain section, but quinoa also has protein. So it's kind of a protein-rich grain. So kind of a way you can kind of fulfill both of these categories. I'm going to suggest maybe we'll keep all the questions to the end, and that way we kind of keep things moving, because I think we can get very sidetracked with questions if I start taking them now. Okay, so next up, so we have protein is really important. Then we want to focus on foods that are rich in vitamin D. Now, vitamin D is really important because it benefits wound healing, it improves our immunity, and actually deficiency of vitamin D can actually worsen menstrual abnormalities in females. So we want to try to minimize the amount of comorbidities that people have. You obviously can't change necessarily having a bleeding disorder, but we can mitigate some of the other things that we can readily control, right? And so vitamin D is one of those nutrients that as you move away from the equator, populations in general go down in vitamin D because there's less days of sunlight, less hours of sunlight, and B, there's also more cold climates, so you're covered up more, so less of your skin is exposed when you are outside. And C, the angle that the sun's rays hits our skin as we move towards the poles, it's not perpendicular. So you are actually producing much more vitamin D when you're at the equator than when you are in the summer in Canada, outside. All my patients, oh, I don't need vitamin D. I'm outside. I'm very active. It's so much more complex than that. And we wear sunscreens, so that blocks vitamin D. So vitamin D deficiency is so popular, or not popular, but so common. But the degree of your deficiency is going to affect how much vitamin D you're going to supplement with, right? And so, of course, I'm not talking about, specific dosages for vitamin D supplementation, but certain foods that you can incorporate more into your diet, which you'll see why protein ends up being so important, because you see a lot of overlap here. Foods that are rich in protein are also rich in vitamin D. And so cod liver oil, salmon, swordfish, tuna, egg yolks, you can get fortified dairy and orange juice as well. These are all rich in vitamin D. One second, I feel like my screen I'm getting reflection off of my slide, and so like I'm looking so washed out. So anyway, so those are foods that are rich in vitamin D. Now, we can readily test you to see if you're deficient in vitamin D. Now, this is generally not covered by OHIP. It's something that you typically have to pay out of pocket. There are some populations who do get coverage for it. So let's say if you have a disorder that prevents absorption. So like you have celiac disease, or you have Crohn's or colitis, or you have some other autoimmune disease that can affect vitamin D levels. And so that could be covered by OHIP. People who have osteoporosis as well can get vitamin D covered by OHIP, but generally you have to pay out of pocket, whether your naturopath or your medical doctor or nurse practitioner runs it. And this is a really worthwhile test. So, you know, a lot of family doctors will tell my patients, oh, you don't need it, just take 1,000 units of vitamin D daily. But the reality is the degree of your deficiency actually changes how much D you would supplement with. And this is something that even in like the medical guidelines, it's clearly outlined. So why they end up telling their patients that when the guideline clearly says they need to take this amount of thousands of units for this amount of weeks and you retest it? I don't understand why. As a naturopath, I've read the guidelines, but apparently like 80% of my patients' doctors have not. So I encourage you, advocate, tell your doctor, tell your nurse practitioner, you don't mind paying for it, get it tested, because the degree of the deficiency will tell you how much you need to supplement. And just for your reference, like the reference range is there visible on the lab test result, right, that you receive. And now Dynacare and Life Labs, like you're able to get your results as a patient from the labs. You just have to kind of sign up for these programs. But you'll see your results. 100 to 150 is kind of optimal. So if you're less than that, then even if you're kind of considered in the normal range, but you know, like 80 would be considered normal, but it's not really quite optimal for health. So I'm always looking at what's optimal. I want to maximize health and longevity. And there's so much research coming out with vitamin D as well. Just to stay on here one more moment. But you know, vitamin D, we're seeing low levels correlated with cancer. We're seeing low levels correlated with even some more severe COVID infections. So there's really a lot of reason why you might want to have your vitamin D optimized, including vitamin D rich foods in your diet and getting your blood value tested. Now, vitamin C, this is a beneficial nutrient that typically most people aren't so deficient in anymore. I'm sure many of you have heard of, you know, how explorers in the early days, they were getting scurvy because they didn't have any fruits or vegetables, and they were, you know, their teeth were rotting and falling out, their gums were bleeding, and it was really a serious problem in like the age of the explorers. Typically now vitamin C is prevalent in our diet, but foods that are rich in it, just for interest's sake, would be more of the fruits and vegetables, particularly berries, citrus, bell peppers, tomatoes, and all the cruciferous veggies. And cruciferous veggies include things like broccoli and Brussels sprouts, cauliflower, asparagus. So just eat the rainbow, right? You want to have colorful fruits and veg in your diet. Half of your plate, remember, there's going to be a quiz later. I'm just kidding. There's no quiz. But yeah, just keeping that in mind. And vitamin C is beneficial because it improves collagen formation. And again, whenever people with bleeding disorders can be more prone to just simply bleeding, right? Something like a nosebleed or just a simple bump, you might actually be experiencing more injury than a person who doesn't have this kind of disorder. And so vitamin C can benefit repair of the wound, and it actually benefits joint healing as well. And collagen is really important to keep our joints healthy and I want to say youthful, but you know, as we get older, our joints degenerate, and collagen is going to help to promote and prevent degradation in our joints. And so vitamin C helps to form collagen. So vitamin C, you can test it in the blood. It's not something that's typically done. Typically, like, it's not something you're going to commonly find as a deficiency, but if you were curious, absolutely, there is a test. You can run it. I assume it's covered by OHIP. If when a naturopath orders lab work, we just don't get anything covered by OHIP. So like I'm quoting like the Life Labs fee for vitamin C is $13. So if you're curious, kind of inexpensive, you could get it checked. B12. So this is a really important nutrient, like so important. And so many people are actually just in general deficient in vitamin B12. And there's many reasons for this. Vitamin B12 is a really critical vitamin because it helps to regulate how our immune system works, how our nervous system functions. It can affect our mood when it's deficient. It can stabilize our mood when it's in adequate levels. And it may also play a role in our menstrual cycle as well, so regulating that bleeding. Now, B12, one of the reasons why people don't get enough of it is, like I said earlier, people don't eat enough protein in general. And if you're a plant-based person, then guess what? There's not much of any protein, not much of any B12 in your diet. So really the only plant-based source of B12 is nutritional yeast. Some of you may be like, what? Nutritional what? And so nutritional yeast is like a kind of like a cheesy substance. It's not cheese though, it's a plant-based product. It's made with yeast, so it's like a type of fungus, so slightly different than a fungus. I'm over maybe simplifying things, but it has kind of a cheesy substance or cheesy texture, like you would kind of almost like you could substitute Parmesan cheese with it. And then of course, eggs, meat, fish, seafood, they're the only food sources of B12. All the other B vitamins you can get through fruits and vegetables. So typically they're not as commonly deficient, but in patients as we get older, you don't absorb B12 as adequately. And as people get older, they're more prone to having heartburn, reflux, stomach ulcers. And so then they take medications that block that absorption. So if you take a drug called a proton pump inhibitor, that would be like pantoprazole or Pantoloc, those drugs actually prevent the absorption of B12. So you actually shouldn't be taking those drugs long-term. It's again another one of my frustrations. Those patients will come in having taken those meds for years, and it clearly says on the label of the drug insert, like you shouldn't be on it for more than a certain number of months, and that these nutrients need to be tested to make sure you're not deficient. So vitamin B12, if it's actually deficient for a long period of time, it can actually lead to permanent nerve damage and permanent memory, permanent cognitive issues. And so it's possible that people who end up in a nursing home diagnosed with dementia, like they might have actually just had a B12 deficiency that was never diagnosed. And so it's hard to kind of determine that retroactively, because a lot of elderly people in general are deficient in B12. A lot of people in general are deficient in B12. You don't have to be in your senior years. I have lots of patients in their 20s and 30s and 40s who are either supplementing or getting B12 shots, because it's something that is really actually quite a common issue. So again, lack of B12 in the diet, poor absorption, maybe they have digestive issues, and then maybe there's medications that prevent its absorption. And this is a nutrient that, again, you can get tested. It's definitely covered by OHIP. And if you don't have a family doctor or you wanted to work with a naturopath, like it's affordable. It's $16 to get it tested. This is another tricky thing, like how much is enough? So vitamin B12 in the reference range, where this set point is, like it's kind of a wide reference range. So if you look at someone's someone's lab report, it's going to say like 156 to like kind of 600-ish, depending on the lab, the numbers will be different. But below 156 or like 136, again, depending on the lab, it's like that's permanent neurological defects. So you never want to be like near the bottom of the reference range. You want to be like more. And so that's where I would encourage, if you get your B12 check, like you want to be high up, 400, 500, 600 would be an adequate blood level in those picomoles per liter, if you're like wondering what the units are. So it's obviously a very small amount of B12 in the blood. But we need B12 in our blood so that it crosses over into our nervous system, where it helps our, like I said earlier, helps our mood, it helps our energy, it helps with regulating even aspects of our digestion, it regulates our immune system, and definitely there are types of anemias that are due to B12 deficiency. And, only until like, they touch on this in Downton Abbey, like only until the Downton Abbey, the Victorian era or actually, I don't even know, Downton Abbey, Victorian. Anyway, I'm sure most of you know this common TV show. Up until that point in time, they had no cure for B12 deficiency. We had no B12 supplementation. You would die of B12 deficiency. So this is a relatively new disease that we can cure, let's say, with deficiency of B12, because if you've heard of pernicious anemia, it's a type of anemia that is B12 deficient. So you're not building your red blood cells properly because of the lack of B12. Or you're pumping out, your blood cells are not maturing enough, so you pump out a lot of immature red blood cells. And so immature blood cells just don't work as properly as if they had matured properly. Anyway, I'm going down a road of too much physiology. You don't need to worry so much about that. But something you do want to be aware of, if you're taking a B12 supplement, you do want to make sure you're taking the right form. So this cyanocobalamin, just like put an X through that, cyano, this means cyanide. Cyanide is bad. We don't like cyanide. This is the synthetic form of B12. It's not biologically active. You need your liver to like cut off the cyanide group, add this methyl group, which is a carbon group with 3 hydrogens. Again, don't worry. You don't need to worry about all this complicated stuff, but you just need to know if you supplement with B12, you want it to be in this form, methyl, okay? And the reason is about half of the population cannot convert that inactive synthetic form of B12 into the active form, methyl. So if you are supplementing, because this is something many patients come in already taking B12, just make sure you're taking the right kind of B12. So that's something to think about. And I repeated this on the same slide, on the next slide. Hopefully I haven't lost anybody yet. I know I'm a fast talker. So next up, we have iron deficiency. So iron deficiency is more pervasive than people realize. It can contribute to, because people might have underlying anxiety and depression. So use cause, loosely, because there can be lots of contributors to these things, but it can lead to increase in anxiety, in depression, insomnia, fatigue. Headaches can be more common with people who are iron deficient, and migraines, hair loss. So if anyone is reporting like hair loss, you want to make sure that the ferritin, which is the blood storage form of iron, is at least up to 80. And so I'm going to come back to that in a little bit. I'm getting ahead of myself. So hair loss, changes to nails, chronic pain, restless legs, cold intolerance, short of breath. These are just some of the most common symptoms that people who are iron deficient might experience. I just had a lady today near the end of my workday that had almost all of these symptoms except for, she's like, I have all those except for the restless legs. So it can be very common. And you might not realize that those are even connected, right? Because like, who thinks hair loss and insomnia and anxiety could even be related, right? So a couple of things you want to recognize with regards to iron. Iron is a very, in general, poorly absorbed nutrient. We only typically absorb maybe 9% of the iron in our diet, or the iron that we supplement with. And it's just a difficult mineral to absorb. It interacts with other things. So like if you pair it with like milk and things like that, like it ends up getting blocked in terms of its absorption. So you want to try to maximize, if you're someone who has low iron in your body, which again, a blood test can validate this. So if your ferritin, which is the type of iron store in the blood that we test for in conventional medicine, if it's low, then this is something you're going to want to supplement with. Now, if it's low, we also have to figure out, why is it low? Are you not absorbing it properly? Are you losing blood? Okay, if you have a bleeding disorder, well, that makes it more likely that it's because you're more prone to bleed. And iron deficiency is relatively common even in people who don't have bleeding disorders. But certainly if you have a bleeding disorder, it's going to be more likely to be a problem. Now, the tricky thing here, the most commonly run blood test is ferritin. However, if you have a disease or a problem where there's inflammation in the body, sometimes iron can come back very normal, or it can come back even elevated above the normal. And so it almost looks like you might have iron toxicity or adequate iron. If you're having those symptoms on the other slide, to run the ferritin may not be just enough. You have to also run something called an iron panel, which is something that actually screens for the actual blood level of iron, and something called total iron binding capacity, TIBC. Don't worry about remembering all these things. All I'm letting you know is there's ferritin on your blood work, and there's also something called an iron panel. Sometimes you need both of those things in order to really accurately assess things. But for most people, just running the ferritin is enough. If it's low, then we have our answer. We know you have some sort of iron deficiency. But if it's elevated or high in the normal and you're someone with a bleeding disorder, it's like, okay, there's something else going on. Maybe there's some inflammation going on, or there's some other chronic disease, because autoimmune diseases can also increase inflammation, and that has a weird mechanism where it actually increases the iron stores in the liver, because the liver is kind of inflamed. And so you're not actually having excess iron, but it appears high on the lab test. Anyway, I'm giving you so much pathophysiology that probably you don't need to know, but I just kind of want you to have an understanding of how we can screen for these things. And sometimes people don't know when they got blood tests done from their doctor. They're like, oh yeah, everything was normal. It's like, well, what was normal? What did they test? What didn't they test? And it's important to really look at the actual nitty gritty, because as the layperson, you don't know what blood tests are needed, right? So that's why I kind of wanted to highlight how some of these nutrients are really important to test and that they can be tested. So if you are deficient in iron, foods that are rich in heme iron are going to be the most easy types of iron to absorb. Now, the problem is, as you can see, it's all animal protein. So heme iron is just a type of iron that is easy to absorb. There's also something called non-heme iron, which I'll get to in a moment, which is more in plant-based or more in just plant foods, like foods that are not necessarily protein, but like leafy greens and that sort of thing might have some iron as well. But if you notice here, even in beef or chicken, which is a good source of iron, it's only 3.5 milligrams. So it's not very much. Now, the average person, let's say the average male, needs about 8 grams of iron a day. So now you can see where that protein, 3 meals a day, a quarter of your meal being protein, why you're going to try to get to that, because that's going to give you an adequate amount of iron in your diet. For menstruating females, the number is much higher. It's around 18 milligrams a day. If you're pregnant, it's even higher. It's in the 20 to 30 milligram range. Obviously, children, it's going to be very different depending on their age, but obviously it'll be lower than the adult amount. But you can see how for someone with not even iron deficiency, that's a lot of iron you need in an average day. Men, 8 milligrams a day. Menstruating females, between like around 18 to 20 milligrams. After menopause, because women aren't menstruating, the amount goes down to about 8 to 10 milligrams, very similar to the male iron amount. So, and notice fish, 0.3 milligram per 3 ounces. I guess that's very minimal. And that's our good iron source food. So then we have foods that are rich in non-heme iron. So non-heme, just all you need to know, it's like a less absorbable form, okay? A lot of molecules come in different forms, just like I showed you, the B12 has slightly, they're still B12, but they come in different kinds, different forms, different chemical structures. So the type of iron that's in more plant-based foods, that's not as absorbable, but there's still iron there. You still can absorb some of that, and these are good sources of iron. So spinach, although I know Popeye made you think that there was so much iron in the spinach, but you're like, oh, it's not even a milligram. And there is a tea called nettle tea, which stinging nettle is like actually a common like just plant that grows in the wild in Ontario. So you can make a tea out of nettle tea, and it is considered an iron-rich tea. And I put the quotes because, like you can see, it's not quite that strong, but it's still a source of iron. It's still a form of minerals, and other teas would have even less iron. So this still makes it a good iron source. Now, something that's kind of unique, which I tried to put in the picture there, I know it's a little bit blurry, but you can get something called an iron fish. And literally, like, the WHO came out with this idea. Well, I don't know if they came out with it, but they used the idea in developing nations where people are iron deficient and can't maybe access getting regular care. And so they distributed these iron fish that people can add to a pot of like a soup or a stew that they're cooking, and it literally leaches some iron into the food that you're having. And you can use this iron fish like 1,800 times, and it will still be adding iron to your food. So you can use it for years. So you can order this like online easily. It's maybe 40 or 50 bucks. And you could be cooking, especially with foods with liquids. This is going to be something that's going to easily add iron to your food. and then you would just kind of wipe it clean. You could also use a cast iron skillet. Obviously, that's always heavier and you can't soak it. You have to wipe it clean after. It involves a little bit, it's a little bit more needy in terms of your pots and pans that you might want to use, but the bonus is it's going to add iron to your food. So those are two little hacks that can help increase your iron that aren't even necessarily nutrition related, but not an actual food that you're ingesting. Next up, so we also have, again, I'm not giving quite a prescription, but just there are solutions if you're someone who is menstruating, who has really heavy periods. So the medical term for that is menorrhagia. It's very common just in women in general, and especially as women get older, it tends to be more of an issue. So especially like after, let's say 38, 39, 40, between 40 and when women experience menopause, women are more prone to heavier menstrual cycles and having excess bleeding. And then you couple it with someone who has a maybe inherited bleeding or genetic bleeding disorder, that's a recipe for lots of problems. And so the thing is, if you have low iron and B12, it actually improperly built, the uterine lining doesn't build up adequately, and then that improper lining actually leads to more bleeding. So again, multiple factors can contribute to that heavy bleeding, and that's why it's important to rule out that there's not other things leading to the cause. You may just say, oh, I have hemophilia, and so you know, you don't look any further, but there could be other things contributing to why you have a heavy period. And there's definitely things that we can use to benefit and slow down heavy flows. I use acupuncture quite a lot in my practice, and it's something that we learn as naturopathic doctors. Not every naturopath practices acupuncture once they're finished school, but it's something that I have definitely a personal interest in, and I have a lot of knowledge in terms of using Western herbs and Chinese herbs as well. And so I often use a lot of herbs. And so typically the herbs are done as little like a tablet or as a liquid. We call it a tincture. And there's particularly these herbs here that I've listed that can help slow down heavy flows. So ginger is a good one, yarrow, shepherd's purse, geranium. And I mean, you can certainly drink ginger tea and have ginger in your cooking, but I'm talking about it more in like a concentrated form, like as an herb or like a supplement. So of course, I'm not recommending if you have a bleeding disorder, you're having heavy menstrual periods, don't start treating yourself. Like, come and talk to someone who knows what's going on so we can figure out which herb would be the most appropriate for you. And the other thing is too, we always have to look at like, is there also another cause to that heavy bleeding? Like, we can never just assume it's the thing that we think is the most obvious. You know, as women get older, they're more at risk for getting things like fibroids. A fibroid is a type of benign tumor, but they can lead to heavy periods and painful periods, even difficult pregnancies. Things like thyroid diseases can lead to heavier periods. So again, something else we could check on lab work is how is your thyroid working? And just in general in the perimenopausal years, so perimenopause is like kind of the years leading up to menopause. Menopause means like 1 year, 1 full year, you didn't have your period, then we consider like, okay, like you're in menopause, assuming you're like of the age, you know, around 50. But sometimes some women go through more premature menopause. And again, there's lab work we can do to screen for that as well. But in the perimenopausal years, those are like the years like leading up to the stopping of regular periods. So there could be a lot of irregular periods, really heavy periods, unpredictable periods. And what's happening during that time is progesterone and estrogen are very fluctuating greatly. And they're not, sometimes they're normal, sometimes they're not. Sometimes you're maybe lacking iron, lacking estrogen or lacking progesterone. And so that can lead to other problems. And so again, there's certain herbs we can use or just nutrients that we can remedy these things. And in terms of certain cancers can also lead to heavy bleeding. And especially if you're like a postmenopausal, like you've not had your period in a few years and you start getting bleeding again, this is something we need to check out like ASAP, because you know, it could be something very serious. And so if you're menopausal and you start getting bleeding, this is something we really need to make sure that we've ruled out that there's not anything more serious going on. So I'm trying to think. I feel like I want to add something here, but now I forget what I was going to say. But anyway, long story short, there can definitely be more supplemental solutions for women with heavy menstrual periods. But then we're getting more into a prescription, which I'm kind of limited to how much I can share about those with you guys. But there's definitely, or girls, that can be something that certainly in a one-on-one setting, I could definitely go into that with you. And there can be things that can be really, really helpful. And I've seen a lot of women really improve their quality of life. And even sometimes it's through conventional care too. Like sometimes if you're just getting really thickening uterine lining and it's leading to something called adenomyosis or like just a thickened uterine lining, like a medical doctor or gynecologist can actually do something called an ablation, where they kind of like scrape out the uterine lining, kind of like a DNC, but a little bit different. And that could be really helpful and almost curative for some patients. Sometimes it comes back, but it can also be a solution if you're getting really abnormal growth in the uterine lining that's leading to some of that, it's contributing to some of that excess bleeding. Just because you have a bleeding disorder doesn't mean you can't acquire something else. And these other things I'm talking about are relatively common. So it's always good to rule out that you don't have, another issue going on that's exacerbating what's currently happening.